The trial looked at two combinations, total duration of about 6 months of neoadjuvant hormonal therapy before radical prostatectomy in men with very high-risk disease. And in one group, they used LHRH analogs for about 3 months, and then they checked levels of DHT and testosterone actually in the prostate tissue, and then they continued the abiraterone acetate for another 3 months along with the LHRH analog. And in the other group, they gave them abiraterone acetate as well as LHRH analog for a total of 6 months before radical prostatectomy. And again, at about 3 months, they did prostate biopsies to check the testosterone and DHT levels. And what they reported in this abstract was some pretty impressive results, and that is in about 34% or so of the men who got the complete 6 months of the abiraterone acetate with the LHRH analog. What they found was, in those 34% of men, a dramatic reduction in the volume of cancer, and in a few cases, no cancer at all in the final radical prostatectomy specimen. And that result was reduced by about 15% of massive reduction in the amount of cancer in those men who only got the 3 months of the abiraterone acetate. So this is very interesting work. It's preliminary work, and it's certainly very exciting. We have to remember that there was a tremendous amount of interest in neoadjuvant hormonal therapy using LHRH analogs with or without an anti-androgen going back to the 1990s. And in fact, that data looked very good pathologically, but where things fell apart was in the recurrence rate. So even though you got tremendous pathologic downstaging in those early LHRH analog studies, what happened was, if you followed these patients long enough, their recurrence rates were not really impacted whatsoever. So this is great preliminary work, very exciting, and the group is to be commended, but we're going to have to really wait and see. Are these patients going to fail? Are they going to need additional radiation therapy, or what is their PSA recurrence rate going to be? And hopefully it'll be improved, but again, only time is going to tell. But this is a very important and a very exciting study with some very positive early results.